Men who have prostate cancer have two curative options. One of the options is surgery, one of the options is radiation. We try to do surgery before cancer has had a chance to spread. For example, if it spreads to the bones, then we may have to talk about other options than surgery.
Once we got over the initial shock, we began to look at all the different options. The traditional surgery was one option, the radiation was another option, and then we had heard about this relatively new procedure, the robotic surgery.
I researched this in depth because I had not had but one surgery in my life, so I don't like being cut on. So I looked it over, took the recommendations from my urologist, discussed it with my wife, and after I did the research on the robotic surgery, I found that Dr. Naveen Keller had done this well over 1,500 times as of the time that I had decided to do the robotic surgery.
He talked to both of us and to see how we felt, and was sure that's the kind of surgery he wanted.
And my wife and I decided the best route for me was to have the robotic surgery. My PSA count has been 0 ever since then, and that's what made me happy. I wasn't so sure if I had chemo or those other treatments that it would be 0, but it has been 0 ever since, and I thank the Lord for that.
Before the robot, really most surgeons operated in a conventional open fashion. We would have an incision going from the belly button all the way down to the pubic bone. Once the robot came along and we started to learn how to do surgery in a laparoscopic fashion where we just use really pen-sized incisions, we were able to do the surgery in a way where there's a lot less bleeding, the surgery is more controlled, and depending on how much experience you have with the robot, you can have a greater impact on their recovery as far as their urinary control and their sexual function.
Every man that walks in that office has two great fears, and they may not express it, but it's in their mind. And so, you know, the incontinence messes with your public persona, and the impotence messes with your personal life. And so those two things are just premier in the mind of every man that sits in that chair. And he really did explain thoroughly why this procedure preserved nerves that kept those two things from being preeminent in the outcome of the surgery.
We use the latest robot, the Da Vinci SI. The robot has 4 arms to it. One of the arms operates the camera. The camera is a remarkable 3D scope, so we can see with depth perception, and we can see with zoom up to 8 to 10 times normal magnification. Along with the 3D vision, with the camera that the robot has, the camera allows us to see structures that with open surgery we just can't appreciate. With the robot, the camera can move right where you want it, and you can see things exactly the way you need it. The arms of the robot, when they come in, they move very precisely. They articulate like your wrists, and they don't have any tremor. So what that allows you to do is to maneuver in tight areas, and really allows you to take your time to perform parts of the surgery properly. And finally, I can make a nice wide movement with my arms or with my hands, and the robot is able to scale those motions into tiny movements, which can also help you with the accuracy and precision during the case.
The one thing that really caught our attention was that, you know, his recovery time was going to be so much shorter than the other options.
I was up about 3 hours after I had the surgery, but I did walk the next day after I was released from the hospital. As a matter of fact, when I came home, I walked up the stairs.
My team and I have done over 2,000 robotic prostatectomies. It's been the same team really since I've been here, which has been remarkable because everything functions better when you have a team.
The truth is that with all of the other procedures that concern radiation, if there is a recurrence, there are very few things that you really can do. We decided let's leave ourselves options if something were to happen. And so we did, and we were very happy with Dr. Keller, and obviously I've recommended him many times. So yes, I would highly recommend it because it does leave you options, and it really does leave you with the lifestyle I think that you really want to have.